जी अस्सलाम वालेकुम व्यूअर्स। आज मेरे साथ हैं जनाब डॉक्टर वसीम उस्मानी साहब एंड मैं थोड़ा सा उनका तारुफ करवाऊँ आप लोगों के साथ कि डॉक्टर साहब जो हैं वो मेडिकल डॉक्टर हैं और रेड क्रॉस के साथ काम करते हैं, लेकिन इनकी स्पेशलिटी ये है कि ये सर्टिफाइड ट्रेनर हैं फॉर CPR। तो आज JRJ मस्जिद में हमने इनको दावत दी है कि यहाँ हमारी जो कम्युनिटी है इनको थोड़ा सा CPR के बारे में अवेयरनेस दें ताकि इनको पता चले कि खुदा न खास्ता अगर कोई घर में इमरजेंसी हो जाती है तो उस केस में हमें क्या करना है। तो उस सिलसिले में हमने डॉक्टर साहब को दावत दी हुई है और इनसे पूछेंगे मुख्तलिफ़ किस्म के सवालात और यहाँ पे ये अपना डेमोन्स्ट्रेशन भी करेंगे, तो हमारे साथ रहें।
ऑलवेज आई एम ऑलवेज हियर। तो कोई भी हेल्प है और हमारा प्लान यही है कि छोटे छोटे इस तरह के अवेयरनेस की चीज़ें कम्युनिटी में दें ताकि कम्युनिटी को इसको से फ़ायदा हो।
सही है। अच्छा वीवर्स, एक चीज़ जो मैं ऐड करना चाहूँगा कि डॉक्टर साहब ट्रेनर ऑफ द ट्रेनर्स हैं, तो ये उस्तादों के उस्ताद हैं, तो इसलिए प्लीज़ इनकी बातों को ज़रा गौर से सुने और मुझे यकीन है कि इट इज़ रियली अ लाइफ सेविंग डेमोन्स्ट्रेशन और ये आपकी ज़िंदगी को बचा।
जी, मैं तो ये कहूँगा कि सब बंदे ये ज़रूर कोर्स ज़िंदगी में एक दफ़ा करें। फर्स्ट एड का कोर्स, स्टैंडर्ड फर्स्ट एड एंड CPR। ये इसलिए नहीं कि जॉब वालों ने कहा है कि जी हमें करना है, ये अपने लिए, अपने बच्चों के लिए, अपनी फैमिली के लिए, अपने माँ बाप के लिए 24 घंटे में किसी को भी कुछ हो सकता है।
ठीक है डॉक्टर साहब, थैंक यू सो मच फॉर कमिंग।
प्लीज ये कोर्स करें।
द फ्लोर इज योर्स। थैंक यू।
One of the things which is called the choking, right? So who knows what is choking is? Okay, just tell me what is choking. One by one. Yes, blue shirt.
Choking is when you have something lodged in your throat and then you can't breathe.
Okay, very good. Okay, so what is emergency? Airway means air, way means passage and path. So the air cannot go through two passage to the lungs. What are these two passage? One is nose and one is mouth. When the air is unable to pass through this difficulty of the passage of the air into the lung is called airways emergency. Okay, an easy word, choking. Okay? So what the book says, what you have to do, only one thing: don't do anything. Only encourage the person to cough and cough and cough. Anyone who the liter capacity of the lung. Why? So the person can cough and sneeze with force and it will come out. Okay? So if you give water, you put your finger, you tap something, what happens? The brain say, okay, you are smarter than me, go ahead. And brain stop function and if it's lie down more complications started. Right? So one thing we know today, we do not have to give water or tapping or disturbing the brain function. Very simple and easy remembering skills, right? Who is going to be my volunteer today? Okay, anyone is eligible to respond? Yes, Saeed. Okay, so I am going to show you this technique, okay, and then you people are going to practice on each other. Good? Okay, so let everyone see. Okay, Saeed. Can you make your hand like this? Face to the public, to the audience. Okay? So when I look at this person, Mahi is unable to make any sound, but his universal choking sign says, he is holding the neck. Right? Okay? Okay, after call 911, what I have to do? Okay, I put one of my leg between the legs. Why? So I'm going to be stable, right? Okay, hold from the shoulder. Ask the person, can you bend, please? Bend, bend, bend. 90 degrees, so the gravity. 90 degrees, so the gravity can help to pull. And then make your palm like this between the shoulder blades and tap 5 times. Then stand up, please. Okay? Then you have to make a fist like this. Use your this muscle area. Okay? Strong hand, right hand is strong, left hand is strong if you're right-handed. Above the belly button, assist with other hand, and then push 5 times. 1, 2, 3, 4, 5. Then hold from shoulder, and then hold back. Ask the person, please bend, bend. 90 degree, good. Okay, it makes more sound, but it is painless. Okay, it's a clapping technique. It's make more sound. Oh my God, you're hurting the person. No. Okay, it's called the cupping effect. Okay, this is a simple, easy technique. How long you have to do this? How long I have to do this technique? I usually try to make some of the golden word easy to remember to my student till pop or drop. How long I have to do? Till pop or drop. Pop means this thing come out. Person feel good. Okay, I can see person is breathing. Then you give water or some secretion, some fluid or something. Good. And the second, pop or drop. What the second thing going to be happen? If the oxygen is not going to the brain shut down. When the brain shut down, the body shut down. That's why my position is important now. Okay? That's why if this person is wiggling or this person is dropping down, I will hold and bring this person on the ground. What is the technique for this one? Okay, so always sit down on the ground, both knees touching on the ground like this. Right? The baby neck is weak. So you have to stabilize the baby neck all the time. Hold the baby from the jaw. Put the baby on your leg, 45-degree angle. Nose and mouth are open. Why 45? So the gravity can help and pull this thing down. Okay? Hold the baby firmly. The baby is in panic. If you're not holding the baby will fall down. Never do this technique on sitting position on chair or on standing position. Why? The baby can fall down anytime. The baby is in panic. A lot of energy. Just like if I'm not breathing, I will do whatever I can do. So you have to hold from the jaw and then same thing. Use the thumb muscle between the shoulder blade 5 times. Then whole head and neck. Sweep the baby other hand. Same position. Between the nipple line center 5 times. 1, 2, 3, 4, 5. All the time, head down. Then again, 1, 2, 3, 4, 5. Then again. Okay? How long I have to do till?
Until it pop or drop.
Pop or drop. If I see something, always use your little finger to clean it. Scoop out, baby is breathing, good job. Give water, milk or something. And the second, 1, 2, 3, 4, 5. Then again, hold from shoulder. Time. Ask the person to stand up. Then again, practice 5 times. When you are going to stop, pop or drop. 3, 4, 5. Then good job, right? Okay. Your workplace, your home. 3 a.m. you awake, you try to eat some muffin, you try to eat some donut, sit down, good job. Okay, thank you. Okay, what you are going to do? You cannot breathe. Okay, so what is that technique is, I will show you. Okay? I am choking, check yourself. What is happening to me? I cannot breathe. Okay, second step, okay, you have your cell phone. Okay, you can talk, we discussed last time, okay? You cannot talk on your cell phone. But if you set up your medical ID, okay, we discussed last time now. When you turn off your phone, you can see a medical ID, medic ID. Please set up the medic ID. This is so important. Why? The medic ID is so important. Anyone can open your cell phone without your password and face ID. This is so important for the ambulance or for doctor or for any other person. Right? Okay? So you can set up the medic ID. When you go into the setting, you can go medic ID. You can put all of your information there. Okay? Your name, okay? And the emergency contact number. Now, if I am choking, what I have to do, I am alone. Very simple technique. Okay? If you have a landline telephone in your home, all landline telephone, which means not the cell phone, the wire one in your workplace or home, they are all automatically connected with emergency medical services. Okay? You simple pick the phone, you dial 911. Okay, and one more thing. Okay, when you are choking and you are dialing 911, extra thing you do, tap your phone, right? When you're tapping your phone, this is again a good clue that some person is choking. It is not a police type of emergency, right? So they will get their mind okay. And how they will get my address? All landline telephone are automatically connected with emergency medical services when we dial our phone number, our home address, and the person who belongs to that address automatically pop up on the screen of the dispatcher automatically. Okay, so having this 911 at home is very important. People, they have everyone's cell phone, but something happened. Old people, heart attack. The people, they have a stroke. The people, they have some other complication, especially choking. Right? They cannot. So many incidents I know. Okay, I'm a paramedic. So many incidents we know. The people, they have the cell phone, but they cannot call because and then they die. After 4 days, when the neighbor they complain. And the police, they break the door, they say the person is already dead 4 days before. Okay? With choking, with heart attack, with a stroke, with a lot of other complications. Simple technique, and we know. Now what I have to do, if I'm choking, I'll pick the phone, I dial 911 from my cell phone. Okay? I cannot dial 911 cell phone. Medic ID, emergency contact, or I use the landline, I dial 911, emergency is coming. Second step, make sure the door is unlocked. If the door is far away, leave the door as it is. Don't go and run. Okay? You will consume more oxygen, you will be fainted right away. And the third most important step is, find out the corner of a chair, bed, sofa, anything, above your belly button, bend again and again. Simple technique. When you bend again and again, more intra-abdominal pressure, they go, very effective, this thing will come out.
If you're like a kid, like a 13-year-old, and you don't have a phone and you're at your house and you choke, what are you gonna do?
You just do this technique.
But if you don't know how?
You don't know how, I showed you.
Then you didn't listen. No.
I just showed you.
Listen if you're not here.
So this person is dropped down, the first thing what you have to do, always find out the person is conscious or sleeping. How to do this? Another golden line. The first golden line I give you, pop and drop. The second golden line is to find out someone is unconscious and sleeping is clap and tap. Are you okay? No response. No response means unconscious. No, again, this is a brain thing. No one can make a false or fake unconsciousness. No one can. When you make a sound wave, these sound waves, they go to the brain, automatically they irritate the brain from the ear and the person opens the eyes. Just like when we are in a deep sleep, your cell phone alarm on, what happened? You awake, even sometimes you don't know where am I. You are so much in deep sleep, right? Okay, because the irritation will make your eyes open, that's when the person is conscious. Good? And now what I have to do with this person? Okay? You have to check 3 things. We discussed last time, We have to check A, B, C. Alright? A means airway. Airway means you have to check nose and mouth. If there is anything, you have to clean. B means breathing. You have to check the person is breathing or not. And C means circulation. The heart is pumping the blood. The heart is pumping the blood or not. Okay? So how to check A, B, C? We will discuss airway. You chin up and head down. Mouth open. If there is anything, clean with the finger. If nothing, good. How to check the breathing? By 3 techniques. You put your ear hole over the tip of the nose, your face over the mouth, your eyes over the chest. Okay? For 5 seconds. 2001, 2002, 2003, 2004, 2005. Look. 2001, 2002, 2003, 2004, 2005. So simple technique. When no ABC you check, you have to do CPR. Clear? Good?
Yeah.
What is the golden line to do CPR? Yes.
After you check ABC.
If no ABC,
If no ABC and they're cold.
then I have to do CPR. Okay? No ABC, CPR. Okay? Before CPR always call 911, bring CPR this person. When you do CPR, person should always be on the hard surface. Never do CPR on the couch, bed and sofa. We need a hard surface so we can pump the heart. Clear? Now to pump the heart, we should know the exact position of the heart. Who is going to tell me now this time? Where is the heart? Yes?
Here?
No. Here and there is not. In medical there is no here and there. Everything is on a proper line. So what is the line for the heart?
On the left?
So where is the heart?
Armpit left.
Under this bone. One of the most strongest bone in the body. The first strongest bone is the thigh. The second is the chest bone. When we do the heart surgery, we have to cut down this bone with the electric saw. You cannot cut down with a knife or scissor or scalpel. Okay? So the heart is shielded under this bone. Right? Okay? So now we know today, we know the exact position of the heart. 4 step, your CPR is 100% right. Only 4 steps you follow, your CPR is 100% right. Right? Good? What are those 4 steps? I will put this on the ground. Okay? The first step is find out the heart line. Armpit to armpit, right? First step. Second step, how big the heart? So I have to cover this like a spider. Third step, lock your elbow, lock your back, right? And fourth step, to space. The space between your knee, the space at the back of the knee, that's all. You put all the pressure of your shoulder all the way down, 30 times, 2 inches depth, hard and fast. 1, 2. If you listen, you will feel the heart is pumping, the rhythm. How many times? 30, 3, 0, 1, 2, 3, 4, 5, 6. Very easy. If you are not doing like this, you will get pain in 2 minutes. You will get your back pain. And you will not be able to make 2 inches depth. Good? CPR. What is the meaning of C? C mean cardio. Cardio mean heart. P mean pulmonary. Pulmonary mean lungs. R mean resuscitation. Resuscitation mean? Yes, bhai.
Bring it back.
Bring back. So which thing we have to back? Bring back 2 things. Heart and lung. Because I checked the lung, I checked the heart, these 2 is not working, so I have to do a technique, and that technique is going to make heart and lung to this body again. This technique is called CPR. Pinch the nose, okay? 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 And give 2 long breathing. First breath, take from outside, 21% oxygen. Cover mouth to mouth. Second one. Right? If you don't have a mask, you can use your clothes, you can use your handkerchief, dupatta, scarf, anything. But if the person is having no bleeding, okay, no infection, the best technique, cover your mouth to mouth of this person. Good? 30 and 2. 30 and 2. 30 and 2. When I have to stop, only one condition. When the person is moving or breathing. The people usually think ambulance is here. Oh, stop, I'm going to open the door for the ambulance. 2 minutes gone. If you stop CPR 1 minute, 10% life is gone. Statistics says 2 minute CPR delay, 20% life is gone. 3 minutes, 30% life is gone. You do not have to rush to open the door or something. When the ambulance people come, they will tap you, okay, thank you very much, move on. Okay, so this is again a misconception that people get left. So you do not have only one thing when the person is moving. When the person moving, stop CPR, turn the person in side position, which is called recovery position. Why? If the person vomit or secretion, everything come on the floor.
If someone is not trained or certified CPR trainer, Can he provide CPR? or not?
Something is better than nothing. But if he had just like this class, here's an idea. If you don't know anything, then don't do. Because you don't know. You think heart is here, huh? If I do the heart, I will break the whole ribs. When you call 911, the first thing they will ask you, do you know how to do CPR? Yes. So now, when we have to stop, when the person is breathing, turn into the recovery position. Why recovery position is? If the person vomit, everything will go on. No. If you're keeping like this 15 minutes, 20 minutes, if this person vomit, what would happen? Everything will go inside. Another choking problem started. You saved the life, and now the person is again in problem. Good? Now, how long I have to do this? Okay? Every 2 minutes, you have to feel the person is breathing or not. Yes, person is breathing. Right? If you have a doubt, I say doubt. If you have a doubt the person is not breathing, put the person in supine position and then check. A, B, C again. Airway, breathing, circulation. If you know A, B, C, then you proceed the next step, start CPR.
So when you put in, say, recovery position,
Yes.
so you have to put some pillow or
No,
something
okay.
under-
Usually the recovery position is a technique. Okay, you have to put the hand like this, so the neck is supported, okay, by the arm.
person's arm.
Person arm. So one arm is here, okay, person neck is there, okay. So person is just like like just like. I will show you. Come here. Lie down. Okay. Okay. So fine, not like this. Okay. So one hand straight. Okay. One hand under the chin. Okay. Okay, put your. Don't have to resist. You are unconscious. So when you are unconscious, you cannot resist. Okay. So this is called recovery position. The common sense is you put on the side position away. If I'm putting toward the person vomit, all this vomit is on me, which is a source of infection. To help someone, always make sure you are safe. You should not be the victim, right? Your safety comes first. Good job, thank you. Right?